I think that the simplest way of explaining it is in relationship to menopause, because that's a concept that most of us understand in some capacity, and that is taught in this case in the pelvic health courses. So effectively, women who have gone through breast cancer treatment or are going through breast cancer treatment, I describe it as menopause at the flick of a switch. It's chemically induced through treatment, menopause, and for some women it's temporary, but for most women it's permanent. And so associated with that, there's something called GSM, or genitourinary syndrome of menopause. And that's basically a newer term that's being used, sort of a catch-all phrase for all those vulvovaginal symptoms that can occur that are associated with menopause, namely, or for example, vulvovaginal dryness, pain with intercourse or penetration, increased urinary tract infections, increased urinary urgency, or incontinence issues as well. So those are the primary areas that I would be dealing with. And just to clarify for your listeners who may not be as aware with pelvic anatomy, is we talk about vulva being the external genitalia, so everything you can see with your eye if you were to take a mirror, and then the vagina is that internal canal. So there is quite a difference between those two. So again, if we're talking specific to a woman who's had breast cancer coming in to see me, every woman I see or man I see, everyone gets screened, has an intake questionnaire, and every single person, whether they're coming to me with a pelvic health concern or not, is screened for pelvic health. Everybody. Because again, if they don't know that it could be a problem, how can I expect them to bring it up? So always starts with a screen. And at that point, as in our first consultation, if they checked any of those tick boxes on my pelvic health screen, then we start that conversation right then and there. So that I think the biggest piece is that education is first and foremost. And I just am so believe this so strongly. You know, my guide is to help get you back to where you want to be. And how can you do that if you don't understand what's going on in your own body? So a lot of education. And then treatment itself would depend on what the problems are. Typically, I can say it's a combination of education, some form of hands-on therapy, depending on what the problem is. Absolutely follow-up exercises that client would take home with them to complement and follow up on the hands-on work we've done. And then gradually getting into more functional pieces, depending on what that person's goals are. I'd love to say that there are volumes of therapists out there who have the dual knowledge of cancer and pelvic health. I think it's getting better, but we've got a ways to go. So even if you can use those search terms to tap in to an oncology therapist or a pelvic health therapist as your starting point, and then you can start to ask the right questions, and we can talk about that a little bit. You are your best advocate, and it's you can't ask what you don't know. And that's where processes like these are brilliant, because it gives you that little bit of knowledge to say, hey, I have that. I'm going to go search and ask. And that is really the best avenue to getting the care that you need at this point.